Hi, my name is Randy, and I was chosen as one of the leaders this week, and will be addressing the second victim phenomenon and what it means to suffer in silence, along with highlighting the Kimberly Height case and the Redonda Font case. The second victim phenomenon refers to the caregivers and staff who experience complex physical harm when they've been involved in an unanticipated patient event, such as a medical error or a patient-related injury or even a patient death. The patient and their family are considered the first victims in this situation. The second victim phenomenon can cause a range of psychological and emotional reactions in the healthcare provider, such as intense guilt and shame, self-doubt about their professional competence, anxiety and depression. They can even experience reliving the event through intrusive thoughts or flashbacks, sleep disturbances. The severity of these symptoms can range from mild distress to symptoms similar to post-traumatic stress disorder, often resulting in burnout, job dissatisfaction, or even the individual leaving their profession altogether. These individuals often suffer in silence, meaning that these victims often do not speak out or receive adequate support for the trauma they've experienced, and instead cope with their distress privately. This is often exacerbated by the perfection and blame culture associated with working in healthcare that can be common today, along with the stigma of admitting their mistakes. This emotional distress is often an example of disenfranchised grief, which is grief that's not openly acknowledged, socially or publicly mourned. And the primary focus remains on the patient and family, leaving the nurse feeling like their own pain and thoughts are invalid or secondary, which further compels them to keep it hidden and to suffer in silence. Next, we can touch on the Kimberly Hyatt case and how it relates to the ANA Code of Ethics for nurses with interpretive statements. The Kimberly Hyatt case highlights the tragic consequences of a medical error, not only for the patient and their family, but also for the healthcare professional involved. In this case, an experienced nurse made a fatal medication error, accidentally giving an 8-month-old baby with a serious heart condition 10 times the correct dose of calcium chloride due to her miscalculation. Hyatt did immediately report her mistake. However, the patient died 5 days following the administration of the medication, and she was ultimately fired from her job. She was also given a large fine and placed on 4 years of supervised probation for any future medication administration. Hyatt is the second victim in this case and reportedly struggled with grief and stress as a result of the outcome of that was associated with the infant patient, and she died by suicide as a result of this grief. The ANA Code of Ethics for nurses does provide guidance that addresses both the accountability for a medical error and the ethical treatment of the nurse involved. Provision 3 is clear that nurses have a primary commitment to patient safety, addressing the accountability and disclosure of their actions, and the responsibility in promoting a culture of safety. While Hyatt immediately assessed the patient and reported her error, the mistake was still made, and she had to deal with the consequences of her actions. Provision 5 emphasizes that a nurse owes the same duties to self as to others, including the responsibility to promote health, safety, and preserve wholeness of character and integrity, and maintain competence. While the nurse does have a duty to herself and to maintain her competence, this case highlights a critical failure in her healthcare system to support its own staff. This again, I think, speaks to the blame and shame culture that some healthcare systems have adopted rather than a just culture. While accountability is necessary, a just culture seeks to distinguish between human error and reckless behavior. Systemic vulnerabilities existed in this situation and contributed to Hyatt being able to make this mistake. With that being said, nurses ultimately are placed in a position of a last check, so to say, the final check to help prevent harm and negative patient outcomes. Next, we'll talk about the Redondavant case. This case is widely cited. It's an example of criminal charges against a nurse for making a medication administration mistake and having criminal charges brought against her. This error occurred after she overrode safeguards in the medication dispensing cabinet and proceeded to administer the medication despite the warning labels even printed directly on the medication vial. These were all indicators that she was in fact pulling the wrong medicine. While she was ordered to give Versed, she instead gave a dose of vecuronium, a paralyzing agent. She immediately self-reported the error when she recognized it and was ultimately fired from her position at the hospital, had her license revoked by the Tennessee Board of Nursing, and was arrested. A jury found her guilty of criminal neglect homicide and gross neglect of an impaired adult. If we're just talking about the influence of this case on the second victim phenomenon, the possibility of criminal charges, such as in this case, fuels the culture of fear and blame. And I would say it's the most extreme form of retribution a healthcare provider can face. That is having criminal charges brought against them for the care that they provided. A just culture acknowledges that human error is inevitable in complex systems and focuses on system redesign rather than individual punishment for honest mistakes. Since this situation did result in the death of the patient and the prosecution of the individual closest to the final step of the error, it could be argued that the legal system effectively ignored the systemic issues that allowed this mistake to happen in the first place, specifically the faulty safeguards that were in place to help prevent this type of event. Typically, medical errors are addressed through civil lawsuits like medical malpractice, professional license board actions like having a nurse license revoked, and internal hospital quality improvement processes. The use of criminal charges kind of shifts the focus from a systems-based analysis of the error to the punitive punishment of an individual. And again, the criminalization of the nurse's error directly undermines the just culture, promoting a blame culture instead. The emotional fallout of this error is already devastating for a second victim, involving intense guilt, shame, self-doubt. Vaughn experienced the destruction of her professional identity and career. There was a multi-year process of professional investigation, a police interrogation, a public criminal trial, and it forces the second victim, the nurse in this case, to continuously relive the trauma under immense scrutiny, including from a public eye. So, considering the criminalization of a nurse's error, like in the Redondavant case, the fear of legal prosecution may influence a nurse's willingness to self-report near misses or actual harmful events. So, my critical thinking question to you is, how does the lack of transparency about systemic errors ultimately impact the patient's right to full disclosure and their perception of the healthcare system's commitment to continuous safety improvement? Thank you for listening, and I look forward to your replies.